sounds good. Let me quickly blow through the innovation funding opportunities. As I mentioned, 7 out of 10 titles in the Health Reform Bill focus on delivery system reform. About 20 of the titles, 20 individual sections, I should say, titles establish demonstrations or pilots. And so the one thing I want to really emphasize is here is funding is the wild card. So when I said that the bill costs 930 or 950 billion, we have to go back and look. I'm not including this $150 billion because there's this funky thing in the federal statute, which is this. The Health Reform Bill authorizes the creation of several programs. And it may say we authorize the expenditure of $100 million for this program. That doesn't mean the money's going to flow. That program then has to go through a congressional appropriations process to actually get the money, right? So I'll give you an example. The National Association of Public Hospitals, with its members, created a concept called the Community-Based Collaborative Care Network. It's in the bill, and it says it's created from 2011 to 2015. Great. And it says you should spend such sums as necessary to get this thing up and running. So now what we're doing is we're fighting through the appropriations process to get the necessary money to make this work so we can partner with our friends at the community health centers to create these community-based collaborative care networks. Those programs that I mentioned that are authorized but not appropriated total $105 billion. This year, the budget appropriations process is a mess. If I had to guess, we will do a continuing resolution and only pass a couple of appropriations bills dealing with appropriations and MilCon. But I don't think that those programs are going to see funding this year. We're already working toward the 2012, fiscal year 2012 appropriations process, but I will tell you, depending on the elections, you can imagine if we see a Republican sweep, are the Republicans really going to want to fund these programs associated with health reform? So we really have to keep an eye on that. There's a lot of opportunities. I mentioned community-based collaborative care networks. One of the big things that's getting a ton of attention in health reform is the Center for Medicare and Medicaid Innovation. This thing's funded at a chunk of change. It's $10 billion. It was created as an alternative to a lot of the Medicare demonstration projects, which seem to lag on and don't really kind of light like fire throughout the healthcare delivery system. So what this innovation center is going to do is they have a ton of flexibility to basically test payment and delivery system reforms, figure out which models work, and disseminate those quickly. On the safety net side, we're super fortunate to have a fellow who is actually well-versed in Medicaid, Anthony Rogers, who's going to be heading this up. We've already had conversations with him. He's interested in doing great partnerships with the safety net, so we're very, very excited. The Medicaid Global Payment System demonstration, I want to mention this quickly because this provision was actually authored by Senator Kerry as a way to address the challenges that the safety net health systems are having in Massachusetts. So right now, up to 5 states can participate in this demonstration project. Starts in 2010, allows them to experiment with their funding source as a way to kind of streamline payments.